Hi, I'm Dr. Jesse and welcome back to the Tuesday Tip. This week we are talking about headaches. I'm going to give you 3 quick tips that you can use to decrease that headache pain. We got a headache coming on. We've talked about this before. It's usually related to some decrease in oxygen in your blood level. So we wanted to show you how you can increase that oxygen, free up that thoracic spine, which helps you to get the oxygen that you need. Then we're going to talk about a lot of times, sometimes those are related to pain here. What happens is the muscles at the base of your skull will tighten up, causing kind of your head to do this. This is if you've been at the computer, you kind of got the headache where your head feels like somebody's squeezing you, you're going to pop like a melon. And then the last thing we're going to do is can be used for any kind of headache. It helps to calm a lot of that stuff down. First thing we're going to do, I have shown this before, but I'm going to show it again. We're going to foam roll that mid back, okay? So we're going to come down here just like this. When you get that headache, get your foam roller out. You're going to come here. You're going to start at the base of the thoracic spine here. That's where it goes from squishy to hard. And we're going to give yourself a hug. And this, you're actually going to look and hopefully mobilize this area, okay? So you may get some releases there, here the pops or whatever. You're going to roll this back and forth. And if you want to isolate it on one side, you can do that. Isolate it on the other side. That will give you that benefit. What we want to do is we want to just free it up. So when you take deep breaths and you're breathing, that you're getting full expansion of your ribs so that you can get the maximum benefit, increasing the oxygen, helping to decrease the amount of headache that you're starting to feel. The other thing you can do, so when we're talking about this tightness at the base of the skull that we want to reduce, what I like to do, this is something that I've been doing for a long time. Anytime I get a headache, I teach a lot of people this, and it always seems to really help them, is to lay on them. So what I'm going to do is I'm going to take my thumbs, I'm going to palm the base of my skull. I'm going to put my thumbs right here in the base of my skull. I'm going to lay down, and I'm going to let kind of the gravity of my head push in there. And what I can do is I go all along the base of my skull, and I find the spots that are tender or where I feel the muscle spasm, and I let the gravity of my head take over. And all I have to do is keep my thumb there, and I get huge benefit, huge relief. Okay? You might feel the the intenseness of the headache will probably go from wrapping around your head to being localized underneath your finger. And that's kind of when you know you're in the right spot to give you relief, okay? The last thing you're going to do, you're going to take a towel. This is just a hand towel. And go ahead and roll it up. Here it doesn't have to be tight or pretty or anything like that, but you go ahead and roll that up. You get an ice pack. You're going to put that ice pack right on top of that, and I'm going to put this right in the base of my neck. We roll the towel up because it kind of fills that space. It accentuates that curve that we want and gets us and fills that hole, and I can also take the towel and grab it. What this is going to do is if you've got the decreased oxygen to the brain, one thing that happens is the blood vessels that go up into your brain dilate, and those blood vessels have pain receptors around them, and that gives you a headache. So if we can get that will cause them to constrict to decrease your pain. Also, if there's inflammation and spasm back here at the base of your neck, the ice will calm that down, decrease your headache, give you some relief before you can get into the chiropractor and get that taken care of. Thanks for watching. We'll catch you next week.